Hi, it's a great day to talk cervical and shoulder assessment and rehab. Had a really interesting case. Dr. Kovacs sent us a patient who was having shoulder pain in the posterior aspect of the shoulder. It's been going on for several months. He had been taking adjustments, had an MRI of the shoulder, no pathology, no tears, had an MRI of the cervical spine, and it showed some arthritic changes, but they're still having problems, shoulder pain. What we noticed was with cervical rotation to the side of the pain, it shot into that same area. Cervical rotation with a flexion, it shot into that same area. So we're thinking, okay, cervical spine, right? Well, when we put the patient in a non-weight bearing posture, all right, we found that they can move the head much better. So that tells us that there was a stability issue. Turn your back towards me. Secondarily, there was a lot of rounding of the shoulders. So it wasn't what we call upper cross distortion. So how are we going to fix it? We checked the rotator cuff, and it was intact neurologically and structurally, no tendonitis or tendinosis. But the other problem was flexion was stuck and painful at about 160 degrees. Where's it coming from? What we did, we went face up. We went face up, and then we found that actively range of motion was fuller and was pain-free, and passively was also pain-free and greater. Flexion with rotation and in neutral was also pain-free and greater. So now we know the patient is unable to hold their head and neck up and turn without pain, which means there's not enough strength coming from the scapular stabilizers and thoracic rib cage. But what about the shoulder? How come they can't move their shoulder? Well, when we palpate the subscapularis with a broad contact, get right on the subscap and bring it up, we felt tight knots in through there and bands, and as we stripped it a couple of times, it opened up that myofascial chain. So subscapularis adhesions and upper cross postural distortion. So how did we fix that? We fixed that with going over some cheerleader exercises with a band, with a red band, and some Brugger's exercises with a red band, okay? Stand up for me. I also had another doctor, turn your back to the camera, who consulted with me on Thursday. He wasn't getting anywhere with his upper cross patients, wasn't getting anywhere. They weren't getting better. And we found out he wasn't doing the stabilization exercise before the Brugger's. So with any of these exercises, you have to pinch, then you externally rotate, then you extend the arms, then you can turn the pinkies up to really get that engagement down below. So make sure you're doing your Brugger's properly, but for Dr. Kovacs' patient, we have to release the subscap, adjust the thoracic spine, of course, and create scapular retraction and depression, strengthen those muscles, and then it's all good. Thanks for tuning in. It's been a great day to talk rehab.